Thank you, Mr. Roskam. You're recognized.
Thank you. Madam Secretary, two quick issues. I think they're pretty straightforward and pretty simple. The House has inquired about the basic health program, and I was able to receive a briefing from your Assistant Secretary for Financial Management, Elaine Murray, who is here today and came and gave me some good insight into the process. Out of that discussion, we put forward a request for documents on something that we learned about, and that was a document called the Big Ugly Table that she said was critical in putting together the basic health plan. Now, recognizing that we're not in litigation, so there's no concern there, we've requested this document and other documents, including the Memorandum of Understanding between CMS and the IRS. The results have not been forthcoming. We've gotten redacted information, followed up, back, forth. The latest was literally 234-page printout of public information from the CMS website that is submitted to Congress. In the spirit of Congressman Rangel and the dispatch with which you were able to easily answer his inquiry, can you get us this big ugly table by the end of the day along with the CMS IRS Memorandum of Understanding?
So, Congressman, my understanding is that we have turned over documents.
They haven't been responsive.
So I would like to follow up with staff to understand what else our staffs need to get.
Great. It's a complete mystery. And I think time is short, so I want to move to another issue, but it's to the point of absurdity. So if you can intervene and get us the big ugly table, which according to the briefing was critical to the decision-making, along with the Memorandum of Understanding between CMS and IRS, that would be helpful. Secondly, we heard testimony at the Oversight Subcommittee about the fraud and erroneous payment rate from CMS. The Deputy Administrator said the number is 12.7%. The remedy, or part of a solution, Mr. Blumenauer and I are working together for a common access card using the same technology that DOD uses and is used in the financial services arena. We received some technical assistance, but it was like pulling teeth from CMS. Had to get the administrator personally involved to get this done. Okay, because he's meeting people who don't want to change things. But this, Madam Secretary, as we both know, is a system that desperately needs to change. Would you be willing to help Mr. Blumenauer and I, as we're trying to move forward, get the technical assistance and put together a common access card pilot program that we can see if it works and if it saves money? We're persuaded it will do that, but we need your help, and we need your personal help, substantively, because we're meeting a lot of passive-aggressive folks that don't want to be helpful. Will you help us?
I will look into seeing what we can do in terms of whether we have authorities. Is it statutory? Is that why we're providing technical assistance? Because it's statutory. Okay. Then let us look into it and understand, because I think hopefully this is the kind of thing that will move us along the electronic health benefits and using technology and data to do delivery system reform. So I'd like to understand it more fulsome and figure out if we can provide technical assistance if it's statutory.
All time has expired, Mr. Dodd.